بسم الله الرحمن الرحيم الحمد لله نستعينه ونستغفره ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا من يهده الله فلا مضل له ومن يضلله فلا هادي له ونشهد أن لا إله إلا الله ونشهد أن سيدنا مولانا محمدا عبده ورسوله صلى الله تعالى آله وأصحابه وسلم تسليما كثيرا كثيرا سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to our Medical Fiqh of Fasting session, inshallah. And today, what I will be doing is I will be talking more so going to the depth of the principles that we really need to understand when we discuss the whole subject of fasting and the invalidators of fasting. So let's make it interactive, inshallah. So if there's any particular questions that you have, you can use chat. And also, if anybody wants to say anything, just raise your hand, inshallah. And then what we can do is we can put you on and you can ask your questions, inshallah. Now, we have a limited time. And this is a quite extensive presentation, quite unique. And we'll be talking about a couple of things. Some of the things you may have already heard of, but that can't be avoided because they're important things and they're a fundamental part of this whole subject. So there's something about rules related to fasting. There's also something about safe fasting. And then finally, about invalidators of fasting. What is it that invalidates fasting? And I'll spend a lot of our time on this last part. But inshallah, you'll have a good understanding, a quite in-depth understanding, inshallah, by the end of this session. So let's just start with the rules of fasting. So, okay, but anyway, the verse of the Quran, which I recited earlier on, يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون. So the whole purpose, and this is something that we should not forget, the whole purpose of fasting, in essence, is to gain a sense of taqwa. So this whole period of fasting is solely for our own personal benefit. And it's been made incumbent and it's been made compulsory on those people who are qualified to fast, those who are mukallaf, because just like it was made compulsory on those people before us, with a very important purpose, and that purpose is that we attain a maqam or a position or a state of taqwa. Now, taqwa doesn't necessarily mean God-fearing, though that is a very important part of taqwa. But taqwa actually means to be in such a state that one has the ability, the motivation, the strength, the patience to abstain from those things that are of a sense of disobedience to our Creator, and to maintain those things that gain His pleasure, subhanahu wa ta'ala. So for that reason, it's important that this is a very, very important state. It's a very serious spiritual state that we are trying to attain. So those things that are normally considered as not only permissible, because that's something that is permissible for you to do in Islam, but there are other things that go beyond permissibility. In other words, if you don't do it, you would end up in a very serious dire situation. You would die. If you don't eat and drink, you will die. But yet, Allah subhanahu wa ta'ala has basically made these things, eating and drinking, haram during the month of Ramadan. Because if you can abstain from something as serious as eating and drinking, which can potentially kill you if you don't eat and drink with certainty, then there is no question about the fact that you have the capacity to abstain from all sins. So this is a lesson in itself. So this Ramadan is like a training program that Allah subhanahu wa ta'ala set us with certain rules that we abide by. So that's the spiritual nature of what we're trying to attain. But there are certain rules that we have to abide by. And on the basis of those rules, we have clearly what we call the fiqh, or the substantive law that relates to the sharia, or the sharia related to how we fast. So we have other verses of the Quran which explain fast the prescribed number of days, except if any of you is ill or on a journey, let him fast a similar number of days later. So clearly Allah subhanahu wa ta'ala recognizes that some of us don't have the capacity to fast because we're unwell, or it's unsafe for us to fast, and it will be at the cost of a higher objective, which is to preserve life. So hifz of nafs, preserving life, is a very, very important part of our Sharia, and hence you will see that if it's to our detriment and we could end up becoming very unwell from fasting, then there are certain exemptions on the basis of that. So you have many verses of the Quran which relate to that. So whoever is ill, marido ala safarin, who was basically on a journey, then he should fast a similar number of days later on, and Allah intends your well-being and does not want you to put you through hardship. So here you can see that clearly, fasting is a very, very important part of a Muslim's nature in terms of self-reformation. So it happens once a year, and hence it's a very, very important time for us all. And the great blessings that we receive and the rewards we receive are uncountable. Now, the question, let's get down to the detail. So the question arises, fasting, who is it obligatory upon? Who is it not obligatory upon? And hopefully we can sum that up in a very simple diagram. So here you will see that I mentioned that children under the age of 12 years are under the age of puberty. So in essence, what that means is when a child has reached balugh, that is in essence puberty, then on the basis of that, it becomes compulsory. It becomes an obligation that they fast. Now, balugh in essence refers to, on average, you're looking at 15 years of age, unless there are certain signs of balugh. So these are the alamatul balugh, and those are signs, for example, the start of menstruation for women, and also for boys if they have a wet dream or something along those lines. Those are early signs that balugh has clearly initiated. So then they would go according to those signs, and if not, then the age. So remember, the other thing important to understand here, when we say 15 years, we're talking about 15 Sharia years, which is the lunar calendar. So it is referring to the lunar years. So on the basis of that, clearly 15 years will be less than that. It'll be 14 years and so many months. So that would be the stage of balugh. However, you notice here that we said children under the 12 years of age. The reason why that's been stated is because we encourage, and you'll find that it's encouraged for children around the age of 12, at least, to start fasting, because then they need to get accustomed to this idea of fasting. So for that reason, 12 years of age is used as the sort of the point at which children should be encouraged to fast. And before that, then it becomes more an optional thing. And depending on the sort of mindset of the family and the children, you'll find that different children sort of fast at different stages. Now, the next important thing is persons clearly incapable of fasting. So clearly, if you're incapable of fasting because of health reasons, then those health reasons may fall under the following remit. So it may be due to physical weakness. So be patients who are acutely unwell, frail or elderly. So there's a clear frailty there that you're not able to fast. So old age, elderly people who are frail, that would be a good reason. Or you're acutely unwell. So you have, a chest infection, you're quite unwell because of COVID, for example. Any of those reasons would exempt you from fasting. The other is about terminal disease. So these patients will be required to offer a fidya, and I'll talk a bit about fidya later on. But generally speaking, if you are at a stage where you have a terminal condition, then depending on the level of frailty, because remember when you talk about terminal conditions like cancer or any other sort of chronic acute chronic kidney disease or end stage kidney disease, some of these patients are palliative as well, so they're in terminal disease. Depending, it's not necessarily just the fact that you're in terminal condition and you've been diagnosed with a cancer and then therefore you don't need to fast. It's to do with your state. So it's all to do with your health. So if your health is quite poor and you're quite frail and you cannot fast, then you are exempt. But if you're healthy, you're feeling quite healthy and you are able to fast without any problems. And even when you're diagnosed with the end stage cancer, then even in those stages, there is some obligation that you should be fasting if you're in a good state. And then clearly recognizing that if your health deteriorates because of that, then there will be exemptions. I will talk a bit about that in a short while. The other is about chronic disease. So if you have, for example, diabetes, you've got bronchitis, these patients will be required to offer fidya if their condition is severe enough for them not to fast. So just because you've got diabetes does not mean that you don't need to fast. Clearly, it requires you to fall within a risk group of diabetics, or a risk group of those who have bronchitis, or a risk group of those who have heart disease for you to be exempt. And finally, we have mental illness. So sometimes mental illness, we don't talk much about this in terms of how this relates to fasting, but mental illness, or if you're learning impaired, so matu' is the term that is usually used in the Sharia in terms of those people who don't have, or majnoon, those people who don't have the mental capacity to fast. Now, what does that mean? How does that how should that be employed here? And I'll make reference to that, inshallah. There's a separate slide that will relate to, when do we know that a person's mentally fit to fast or not? The other kind of questions that we have is about pregnant or breastfeeding mothers, so whose health or child's health will suffer from fasting. So pregnant women and breastfeeding women by default should be fasting. So this is an important point, that if you're pregnant, you should be fasting, and if you're breastfeeding, you should be fasting. However, in a state where if you're pregnant and it will be detrimental to your health, or it will be detrimental to the health of the baby, then in those kind of instances you will be exempt. Now the question is, what do we mean by detriment? So detriment basically means that if a woman reaches a certain state, and we'll talk about those states there where Sharia would exempt fasting, like I said, in a short while. When you reach the state where clearly you are considered as excused, then that would be a separate issue. Same thing with breastfeeding women, recognizing that breastfeeding women clearly, they breastfeed because they're supporting a child. And in those kind of instances, again, then you're not exempt from fasting. You should be fasting. But clearly, if it leads to a situation where your milk production has significantly decreased, whereby the child would suffer as a result of that, then you would be exempt in that situation. Now that is hardly ever the case, except unless we are in a very poor country and in severe poverty, that those kind of situations do tend to arise. Now the other thing is about menstruating women, which is quite clear. Many of you already understand that ruling. There's no need to go into so much detail, but clearly that's considered as a mani', an obstacle, in other words, that you're exempt from fasting during those stages. And also nifas, so haid and nifas, in those situations, postpartum bleeding. But here you're expected to to make up the days missed or at an alternate time. So you're expected to give qada, or do qada. Okay. And then finally, those who are traveling. So this is again is considered somebody who falls in the state of musafir. So this is a kind of a state that you fall into. So you're a state of musafir, or a traveler, and that will vary from 48 to 52 miles, depending on who you relate to and whose advice you take. So on the basis of that, once you achieve that level of state, then on the basis of that, it becomes optional. It doesn't become obligatory upon you to fast. Well, it's encouraged to fast if you can, and unless there is a clear burden on you fasting, then you would be exempt. Okay, so hopefully that explains a few things. We'll go through this, and then inshallah, if there's any questions, I'm sure we'll get opportunity to relate to those questions that you have. Now, atonement expiation, I don't want to spend too much time on this, but generally speaking, the important thing to understand here, sort of from a medical perspective, is that if you are unwell and you are clearly frail, and there are clear issues in terms of your capacity to fast, then the idea there is that you should make up. Initially, the first protocol is that you make up for the fast. You do qada or an alternative time. So this is clearly outside Ramadan. So other than Ramadan, any day other than the Ramadan, then you would do qada. Now, if you are unwell and your health isn't very good, then there's a chance that especially in countries like the UK, and where that part of the hemisphere of the world where the winter fasts are shorter than the summer fasts, then what you need to do is you need to consider whether you can fast during the winter months, where clearly the days are shorter and the time period of fasting is shorter. So then you need to consider that, because this is in essence what is expected of you, to fast on alternate days. And if you can find days where clearly the days are shorter, then you should go for that option and not go straight into the fidya, which sometimes we talk about. So you need to make up for a missed fast of Ramadan on another day with qada. If not, if you're not able to do qada, so this is the important point. If you are unable to do qada, and if your health improves, let's say for example you're cured of a serious illness where you assume that it was not curable, and now you're able to fast, then you will still have to make up for those fasts previous, depending on your health, that you missed, that you gave fidya for, assuming that you are not going to be able to fast ever in your life. So you have to make up for that. So what is fidya? Fidya is basically an atonement when someone cannot fast in Ramadan and can't make up the last days afterwards. So you got chronic severe illness, for example, you got frailty. So this is an end stage sort of state that you're not going to get any better. Then in that stage, you can give, or you give fidya. And this is something which is stipulated very clearly in the Quran, which I mentioned earlier on in the verse. And then you would give fidya in this particular situation, and you would compensate with that. Now, fidya amount generally tends to vary depending who you go to, but usually you're talking about in pounds, it's a couple of pounds, but you need to sort of discuss that with your imam or your local imam, because it does vary with different people. Then finally, there is a kafara, and kafara or expiation is an interesting concept, because what that really suggests is this is a penalty, and then you're expected to compensate, and this is an expiation of the penalty. So this is paid if you deliberately break the fast. So it's an intentional breaking of the fast in the month of Ramadan without a valid reason. And so in this situation, what that really means is that you fasted, you broke the fast with that intention, and it was not an excuse. So in other words, if you became unwell and you had to break the fast, then that does not suggest you have to do a kafara. That's the first thing. The second thing is that this is, in the Sharia, we say it has to be suratan wa ma'nan. Yeah. In other words, it has to be in line with the stipulated explicit verses of the Quran, that it has to be in things, for example, like food and drink. So you broke your fast because you've eaten something or you've drunk something which is considered as food and drink. So let's say if you swallowed an object which is not considered as food or drink, and that would not require kafara, and neither would medicine. So if you had to take certain medicine like an inhaler, or you had to take certain tablets because you were unwell, pain relievers, pain relief or something like that, then that would not suggest a kafara. So it has to be food or drink for you to do a kafara, and it has to be intentional for you to fall into this state of kafara. Okay, and that is to fast consecutively 60 days, or feed people 2 meals for 60 days if you are not able to fast. Okay, right. So now we're going to just talk a bit about safe fasting, because this is important. We need to understand the idea about safe fasting. What does that actually involve? What does it relate to? So on the basis of safe fasting, it's important for us to understand a couple of things. There's a little exercise. I'm not going to really go through the exercise in detail, but I'm just going to outline some of the questions that may arise in circumstances like this, because sometimes these questions do arise, and it's important for us to understand them. But there are certain exercises or certain examples that if we observe, it'll help us to understand some of these principles better. Then I mentioned earlier on that I'm going to talk about a principled approach about who qualifies as being unwell, so they are exempt. What is the approach to that? And this is something that I've taught before, so some of you are probably familiar with this, but there is something quite novel that I will be teaching later on after this, which a lot of you are not familiar with, inshallah. So also, what does it mean by fasting and hardship? What does that mean? So sometimes we talk about children who are, for example, balugh, they've achieved a mature age, but they're doing exams they're doing GCSEs or A levels or university exams, etc. And are they exempt now? So therefore, is this question of hardship? Or you're a physician, you're a doctor, you're doing surgical operations through the day, and clearly that's problematic. There's a sense of hardship for you. Are you exempt on that basis? So we'll just talk a bit about that, and then finally we'll just talk a bit about a couple of conditions like diabetes and other conditions and how this would relate to that. So let's say, for example, here are a couple of examples. So there's something to think about. We don't need to answer this now, but you think about this. So patient who suffers from asthma and hay fever. So somebody who suffers from asthma and hay fever, and they've got quite moderate sort of level asthma, not mild, and they do regularly use their inhalers, and also may use regular nasal sprays for the hay fever, or may take antihistamines tablets. What's the situation with them? Are they exempt? Then you have the situation of frail elderly woman. So you've got somebody who's quite frail, elderly, she struggles. Would she be exempt? Is it her age, or is it just solely about her frailty and her health? And then the next thing is about a young man with severe back pain. So you've got severe pain. Would that be an exemption from fasting? Because you need to take regular painkillers or pain relief throughout the day. So would that give you some kind of exemption from fasting? Or even, I remember somebody rang me last year about gout. They had severe gout, and they were asking, would they be exempt from fasting because of their gout? And gout can be very severe in terms of its pain. So they had a very painful foot, and hence they wanted some advice on that. Then you have a woman recently delivered and suffering from depression. So this is an interesting one. So somebody who's suffering from postnatal depression. So she's just delivered a couple of weeks, even 2 months or so after delivery, and she's clearly suffering from depression, feeling quite low, not sleeping, a lot of anxiety. Is she exempt from fasting in that situation? Then you have somebody, a young boy, sitting for their GCSE exams. Somebody who's a Balagh, maturity, and they're sitting exams. Would they be exempt? Because GCSE exams are clearly very important, and what would the situation be there? And finally, we've got a diabetic patient on insulin. So somebody who's clearly got a chronic disease, and they are taking insulin, what puts them at risk. So in those kind of individuals, are they exempt in this particular situation? So those are kind of questions that you want to be thinking about as we go through this sort of next sort of 4-principle approach. Now, the Sharia stipulates sort of explicitly or implicitly by the fuqaha 4 particular issues, which probably would help us to navigate through this whole idea of how we deal with people who are fasting and when they become exempt. So the first is worsening physical conditions. So these are the things that escalate. Okay, so these are things that are considered as escalators, the things that escalate. The question is, then we reach a threshold at what stage do we say now this person is exempt? So if you find that your condition would worsen, so that's your physical condition would worsen if you fast. So you could argue and say, look, if I fast, I regularly walk to work, I would struggle. I am regularly working in a warm climate, and I would struggle fasting because I feel dehydrated, etc., etc. So that's fine. So you can argue and say that my physical condition would worsen, but then the question arises: at what stage would you say now you are exempt? Okay, and we'll come to that in a second. So the other thing is, the other sort of principled approach is slower recovery. So here we have the question of your recovery is slower. Okay, so if you fast, then that will slow down your recovery, and that would mean that you would have that condition for a lot longer. For example, so let's say you had a chest infection, and you began to fast, and then because you're fasting and you're sort of a bit more dehydrated and you're feeling more weak, then your recovery is being slowed down. Now the question arises, like if you had a minor symptoms, for example, you just had the common cold, and clearly that may still affect your recovery. What stage would you say now that that kind of individual would be exempt from fasting? So there clearly has to reach a certain threshold for us to say that. Again, worsening mental condition. So what does that actually mean? So these are, when we talk about mental conditions, we're talking about symptomatology. So we're recognizing there are certain symptoms. So clearly, if somebody is feeling low, they have very low mood, then what does that actually mean? Because we can go through certain stages in our life where our mood is low, but we haven't we're not unwell in the sense that we are, we could be labeled as somebody who's depressed. So we have poor sleep, we have low mood, and this is affecting us in certain ways. So again, when is the threshold of when we decide that somebody's mental condition is so severe that they are now, exempt from fasting? And then we have pain. So we discussed the issue of pain. So worsening pain is another an example. So somebody clearly has lower back pain, severe lower back pain. To what degree would that pain have to be? I remember pain can be quite subjective. So, it really doesn't matter whether it's subjective. The main thing is, how is that pain affecting that individual? And that's leads on to this point about thresholds. So it's described as an inability to physically, mentally perform normal and important daily chores. Okay, so there are examples given in the books of fiqh. For example, a person not able to walk, a person not able to ride a horse, and things like that are described. So these are, and remember, at that time, riding a horse was considered as a necessary act to carry out the normal daily chores. You had to travel and you had to get certain things. So hence, unable to physically, mentally perform normal and important daily chores. So in other words, you're struggling getting into the bathroom, you're struggling, getting up and, making your own breakfast. You're struggling to even get around the house. If you're on your own, you're not able to go out and, buy food for yourself. There's nobody else to help you in that situation. So here, those normal daily and important chores that you would need to clearly undergo, they are compromised because of, for example, worsening physical condition. So your physical conditions worsen to that degree, you're not able to carry out those normal daily chores, or your recovery has been slowed down to that degree that you're not able to perform those daily chores, or your mental condition has deteriorated to that degree that you're not able to physically or mentally perform those daily chores. And that could also be related to insight. So you don't understand the rulings, the ahkam of fasting, because you've lost insight. So somebody who's mentally or has psychosis, they clearly will not have that sort of level of understanding in certain times of, when their disease condition is worse. And then also worsening pain. So somebody who's severe back pain, they're not able to get out of bed, they're struggling. And in those kind of situations, they would be also exempt from fasting. So it gives you a certain threshold at which we could say that you would be exempt. So these are the sort of more fundamentally the sort of framework that we should be working from when we are deciding on who should be fasting, who should not be fasting. Now, in terms of hardship, there are many examples that are given with the books of fiqh. I've sort of pulled out a few just to give you a bit of an insight so that you understand some of these basic concepts. So if a person's work is hard, so these are something that's mentioned in Sharh Muntaha al-Iradat and various other books from the different madhahib, so Mawsu' al-Fiqhiyya, the Encyclopedia of Fiqh, and also we have Fatawa al-Lajna al-Da'ima, and these are sort of Muslim bodies of ulama who have made these decisions. But you will find these, in Hashia ibn Abidin's Hanafi book, Kishaf al-Qina', Hanbali, Bahuti, and so forth. Hanbali and Shafi and fiqh books, they sort of indicate the same kind of thing. The idea is, if a person's work is hard and he will be harmed by giving it up, and he is afraid of physical harm, then he may break the fast and make it up later. So in other words, what that really indicates, and I'll just go through all of them and then I'll give you the sort of the general understanding of the gist of it. Regards to those whose work involves physical effort and who are in need of their earnings, such as bakers and harvesters, if he knows that if he works, he will encounter harm that may make it impermissible for him not to fast. Then in that case, it is haram for him to break the fast while he actually encounters hardship. And then finally, you have, it is not permissible for a worker to break the fast during the day in a Ramadan just because he is working. But if he encounters great hardship that forces him to break the fast during the day, then he may break the fast with something that will ward off that hardship. And then refrain from eating and drinking. Now, there is a couple of things here that, so there are similar kind of statements like this in the books of fiqh, but this is a kind of a rubric that you can use to define what that means for us. So when is a worker excused? When is a person excused? Then it's on the basis of these. So the first is, if you look at this sort of diagram here, again, physical, mental harm to self. So if by fasting in their workplace, there will be physical, mental harm to self, okay, that would be a good indication. And we talk about physical, mental harm to self would have to reach that threshold about not being able to carry out normal daily chores. The other is about significant risk of losing job or earnings. So this is clearly something that's stipulated as well. So if it means that you could lose your job, or you're not able to perform a job because of the fact that you're fasting, then in those particular instances, then if that job is an important job where you gain your livelihood from, then you would be exempt. But that's something that you would have to discuss with a mufti or a scholar, Muslim scholar, or an imam regarding what that would mean for you. Then there is what we consider as medical legal reasons. So for physicians especially, because I know most of you are physicians who are on this group at the moment. So medical legal reasons would be things like, for example, clearly you have an obligation to ensure that you're caring for your patients. So if you have a surgical list and it so happens that you're not able to think clearly, you can lose your concentration at the risk of harm to your patient or negligence, then that would be an excuse for you not to fast. However, you would have to make certain plans to ensure that you're not in that state. So in other words, you would have to make serious effort in actually moving your surgical list. I know it's a whole month, but even taking your annual leave during that time, or reducing a surgical list, getting somebody else to to support you in that list, or make some kind of amends in your normal calendar during that month of Ramadan to cope with that. Even making your surgical list shorter, etc., or certain times in the day. So that's something that you would be expected to do before you fall into this idea of being excused from that, and that falls into the risk of harm to the patient. So the weakness due to fasting must be a real cause, a real risk leading to these, and that's important for you to understand. And what that really means is, even though in the books it mentions that you have to reach a state of ghalabat al-dhann, in other words, there has to be a dominant probability in your mind that I will become unwell if I do this. Not that there's a very small possibility that I may become unwell. So one approach that the Muslim scholars do identify is the concept of tajriba. Tajriba means that you have knowledge, a history, or an experience that you did this last time and you were unable to fast, or you felt very unwell and there was some risk to you or risk to your patients. So hence that is an experience that you have, and that would be sufficient enough. If it reached a level of dominant probability that that's likely to occur again, then you can exempt yourself from fasting. However, if you are somebody who has not experienced this, but it's a mindset that, look, I think I'm going to struggle with this, then it's better for you to fast. You fast and trial fast. So you trial fast, and the best time to do trial fast is in the month of Shawwal, which is the month prior to Ramadan. Do some trial fasts and see how you feel, because Shawwal is a good month to fast, and it's very rewarding for us to do that in that month, and see how you are, and if you find that actually it's not as bad, as I thought it was, and then you should maintain and fast. Remember, the whole purpose of fasting is for your personal benefit. It's spiritually enhancing, and you should try to do it to the best of your ability. And these are just exemptions. They're not excuses, they're exemptions, in the sense that this is what the Sharia says, that it's advisable for you not to fast. That's what it's doing. Not that this is a window opportunity for you to make an excuse. So the mindset has to be right. The way you approach this has to be correct. So you need, so suggesting you need to start fasting first, and can only break the fast when you feel weak. And that's something that's recommended if you haven't reached a state of what we call dominant probability, which is about 70 to 80% chance that you will become unwell. If you're thinking around about 50% chance that I will become unwell, then ideally what you should be doing is you should be fasting and trialing it out and seeing if you're unwell. And if you clearly recognize you're not unwell, then that would be a precedence for you not to fast the other days if you're still in that state. The other thing is intention is essential. So deliberately choosing to work during fasting hours so as to have excuse not this isn't acceptable. This is sinful because your intention is faulty. In a'mal biniyat, your intentions are through your action. Your actions are through your intention. So on the basis of this, it's important that you do make an effort to ensure that your daily schedule is such that it's not burdening your fast, and also that to make up fast qada in those instances where clearly you have to miss those days because of hardship. Okay, what I'll do is I'll try to answer some of the question. So what is the reasoning that menstruating women cannot fast? Is it due to the physical weakness that comes with menstruation? If so, then would it be the same category as an ill person? Thus, will a menstruating woman be able to fast if she feels okay? The reason why menstruating women are not expected to fast, or they should not be fasting, in fact, is not because of weakness. Okay, and this is a very important point to take. The reason, as from the Sharia perspective, is because Allah has stipulated it, and it's simple as that. Because the wahi is explicit in that women who are in the state of menstruation, they should not be fasting. So this is it's haram for you to even fast in the state of menstruation because of the hukum shari. The hukum shari is clearly there. Now, the wisdom behind that, we can speculate what the wisdom behind that is, but generally it's because a woman is considered as being in an impure ritual state. And an impure ritual state meaning that she, in that state, would not have achieved a pure enough state for her to actually fast. So that's so some of the reasons that Muslim jurists explain. However, there is a certain sense of wisdom in all Allah's rules, and we don't sometimes comprehend them because we only think short term, and the Sharia thinks long term. And we always just think towards on the basis of individuals when the Sharia thinks in terms of a community societal level. So long-term societal level, that's the hikmah of the Sharia, and we can't grasp that because there are too many variables for us to be able to predict the outcome in long-term projection as well as on a global projection. So for that reason we follow the wahi, the revelation of Allah subhanahu wa ta'ala, and we follow it from that point of view. So the next question is, what about if you are prone to migraines? Do you fast? And if you get a headache, take medication before it reaches migraine level? So yeah, that's a good question. So if you're somebody who gets regular migraines, now you go by tajriba, so you go by experience, that that when I fast, and I've had this question put to me before, that when I fast, my migraines become so severe that I cannot cope with daily chores. Okay, so and it may be some minor sort of state of dehydration that causes and triggers that off. Now that particular individual, what they did do is they trial fasted. So they trial fasted, see if it still happens, and it was happening. So what they did was they took sort of pain relief, sort of long slow release pain relief or long acting pain relief to see if that benefited them, and it did benefit them. So so they took propranolol, long-acting propranolol, which is a beta blocker, and it helped them. So hence, you need to think of undergo ways that would will prevent it in the first place. And if not, then clearly, if it's severe enough that it's preventing you from doing things and performing a daily chores, then you would be exempt. But you would have to make up for those during sort of the shorter fasting periods, like for example in the winter months. My daughter has her final year medical exams on Monday. She has 5 exams in the same day and will be fasting, but is scared about brain fog and being tired. This is the final exam and impacts her qualifying. Is she exempt or does she have to fast? And this is sometimes, and I've got quite hostile responses by saying this, and I can understand why people are very upset by that kind of response, but the Sharia would not allow it. And this is, I cannot explain it and emphasize it much more clearly than that. The issue here is because there are number one, it's considered in this way that there are alternative ways of dealing with this. In other words, ensuring that she's revised well, she's fully prepared for her exams, that she's not depending on the last day for revision or last few days for revision or the month of Ramadan for revision. That they need to prepare fully for that. The second thing is they need to get a good night's sleep. So they need to ensure that they're getting plenty of sleep and they're getting plenty and they're eating the right kind of food. And from that particular perspective, it should not fog her mind in that sense. if you are somebody who are clearly worshipping throughout the night, or working and studying through the night, and then you're going into the exam room and you're fasting, then it will do. It's going to impact you. So there's no actual evidence to suggest that it will cause issues with your memory or anything like that. I mean, I remember there being some research papers that were produced in one of my previous presentations that suggested that. So from that particular perspective, it really, in reality, that person is not excused. In fact, to think of it from the reverse perspective, and that is from the Sharia perspective and the spiritual perspective, is that maybe Allah will place certain blessings in this. So, trust Allah subhanahu wa ta'ala. Ensure that you're fulfilling the asbab, the means to ensuring that you don't feel unwell, and clearly that you're well hydrated, you're eating well through the day. When you're for suhoor, that you're eating the right kind of food, and you're not indulging in heavy sort of sugary foods, but really relying on carbohydrates and things like that. And then inshallah, and getting plenty of sleep, getting good sleep, inshallah, it should not impact, and being fully prepared, it should not impact her exam results. So here, from that perspective, Allah subhanahu wa ta'ala very clearly said, kutiba alaykum as-siyamu, fast is obligatory upon you. Your spiritual state is more important than a worldly state. And that's the reality of it. That's how important fasting actually is. Okay, so we got some question on chat, I think. Well, I was asking, exempt mean will fall in the middle group where one hand to sponsor someone else fast if you can't fast because of bad health or diabetic or insulin things. Oh yeah, so okay, exempt. Yeah, exempt. I'm not sure. That's probably a question in context with a previous point that I may have mentioned. Maybe we'll come back to that inshallah in a short while. So to fast or not to fast. So clearly we recognize that not all of us have the same level of spiritual motivation to fast. Okay, we recognize that. So the decision to fast during Ramadan is based on important considerations. So you have a personal decision, the decision of the individual. So depending on how seriously and how much of a priority fasting is for them. There's also the idea of religious practice. So there's what the religion stipulates and how seriously they take that religion. And there's also medical opinion. So you make your decisions based on these three factors. So this is then an individual decision that you need to make, and you need to ensure that you go to the right people to get the right kind of answer. Now, I mentioned earlier on. Okay, let me just go back to a couple of questions because the questions are important. So I have made some. Okay, I think we'll need to probably speed up a bit, but I'll try to answer some of your questions here. So there's an anonymous attendee who said, you mentioned Shawwal as the month before Ramadan. I think if you might have meant Shaban. Yeah, sorry, Shaban. Sorry, yes, yeah, Shaban. But, okay, so I well corrected. Yeah, Shaban is the month before Ramadan. Is the notion of pathological the same in modern medicine and in Islamic medicine? If not, can you explain it? The notion of pathological. I mean, I don't really want to sort of fit it into certain brackets of definitions, but generally speaking, I think the main point here is that if you're unwell, and I explain the concepts of, not feeling well in terms of your health, so you are not able to perform your daily chores, etc., etc. And let's just stick to that, and then let's not get into the details of technical terms. So you've got to kindly provide the wahi source wherein the injunction is given to menstruating women not to fast, or that it is forbidden to fast for these menstruating women. Also, purity is not a condition for fasting, as in a man not in a state of ghusl can begin the fast and make the ghusl after the time of suhoor is over, so that can apply. Yeah, inshallah, we will provide the sources for that. There's clear, explicit evidences for menstruating women not to be fasting in Ramadan. So we'll provide the evidence for that. For pregnant or breastfeeding women, how would you determine if you are too unwell to fast? Again, if it's affecting your medical condition. So we talked about that sort of 4-principled rubric. You should follow that and recognize it from that particular perspective. So if you're clearly feeling very weak to the degree, or you've got experience that when I am pregnant, or when I was, I've fasted, in the previous month, and this was my state, and then clearly you could use that as a defining factor to whether you would be able to fast the next day or so. Okay. Okay, inshallah. Okay, 1 second. Right. Okay. So here, this is a reflection of some of the points. But what we'll do is we'll go through these, inshallah, when I talk about the invalidators of fasting in a short while, inshallah. So just very briefly, I'm not going to go through the details of this, but this is an example of diabetes, for example. So you have this idea of traffic rag scaling, red, amber, green, sort of scaling of disease conditions is a very good approach. And this is an approach that the British Islamic Medical Association has used, and they've got some fantastic resources. I would highly recommend that you go to their website and look under their Ramadan resources on diseased conditions. And these resource is being used by non-Muslim medical experts as well. And this has been done, alhamdulillah, we know we've had some Balagh students have been involved in that. I myself have been involved in some of it. And there's some research articles that have come out on the basis of this that have also been, presented as quite reputable journals as well, that I've contributed, and some medical professionals who have engaged with us as well as others have produced some excellent articles on the risk factors and who should be exempt, who should not be exempt. But I mean, this gives you a bit of an idea about who would be exempt, who would not be exempt. So if there's a risk to your health, such as you could end up with hypoglycemia, or you could end up with DKA, which is diabetic ketoacidosis, a state where your blood sugars are so high you become acidotic, then those would be issues of exemption. And clearly you go by first trial fast in certain instances where you're sort of not sure, and see how you feel. And if you're feeling very unwell, then you should break your fast in those instances. And that you're exempt to break your fast, so that's something that you need to take into consideration as well. Okay, so I would recommend that you go to the British Islamic Medical Association website and have a look at their resources. They're excellent. They deal with all sorts of illnesses. So they deal with a lot of this: chronic respiratory disease, COPD, emphysema, severe asthma, bronchitis. So with asthma and bronchitis, the kind of things that you should really be focusing on really is, peak flows are a good approach, because whether your asthma is worsening over time, and then you could work through that. And if your peak flows clearly are worsening, then that this person will probably reach a closer, need regular inhalers. But you can also look at your inhalers as well. So there may be long-acting inhalers. But those recognizes some Muslim jurists do not consider use of inhaler as something that invalidates the fast, whereas a lot do. So clearly, depending on which imam you follow, you'd follow that sort of case. Chronic heart disease, moderate, severe coronary artery disease, and so forth. Chronic renal diseases, renal dialysis, renal transplants, nephrotic syndrome, things like that. There would be issues where you may be exempt. Immunocompromised patients who are taking immunosuppressants. So clearly they need to make sure that their immune system is strong, and because of certain medications they're taking, that would impact their immune system. So hence they may be exempt in certain instances. Chronic severe mental illness, severe depression or psychosis, and also acute illnesses. So you've got, for example, a chest infection or a severe flu, etc., COVID or something along those lines. Then in those instances you'll be exempt, recognizing those 4 principles, and also the issue of the idea of the threshold that you need to be able to achieve for you to be exempt. Okay, so we're going to go into invalidators of fasting, and what I'm going to do is I'm going to go through this at some pace, because we sort of haven't got that much time. But generally speaking, what I will do is I'm going to talk about fundamental principles here, inshallah. So you just bear with me, and then what I'll do is I'll take some questions at the end. So let's just quickly talk a bit about the main fundamental things that Muslim scholars think about when they look around the idea of fasting. So there are things around, and these are sort of the terms that they use. So there is what we call the qualified cavity. Okay, so in other words, if the food or drink enters a qualified cavity, or any kind of object or anything enters the qualified cavity, okay, that is considered as a qualified agent. So number one, it has to be a qualified agent, okay, al-wasil, okay, it has to pass a qualified passage, okay, so this is a manfaz al-mu'tabar, okay, and the process through which it passes has to be qualified, so al-wasul, okay, and it has to enter a qualified cavity, a jawful mu'tabar. Okay, so these are the conditions that are expected. So number one, you have to have a qualified agent. The agent must qualify. It has to pass a qualified passage, okay, through a process which is qualified, and then enter a qualified cavity. And I'll talk a bit about that in a short while. And there are certain absolving states which clearly would would not be considered in terms of those that invalidate your fast, such as, for example, if something happened in a forgetful state, for example. Okay, so that's an absolving state. Now, okay, so what do we look at when it comes to qualified cavity? So qualified cavity is the stomach, the throat, post-pharynx, and I'll talk a bit about that later on, the intestines, stomach to the rectum. So these are the qualified. Anything that enters that qualified cavity would invalidate the fast. Qualified aperture or passage. So this is the passage, as we talk, munfasal mu'tabar. The passage has to be any orifice or opening which is on the surface of the body, be it natural, congenital, or introduced, which communicates with a qualified cavity, a jawful mu'tabar. So any kind of orifice or opening from the surface of the body that directly communicates with a qualified cavity. The mouth, the nose, ear, canals, or only if the tympani, so ear perforated, if there's a perforation in the ear, then there's a possibility it can enter the throat. But other than that, it will not. So there's no qualified direct cavity because there's an obstacle there. So rectum wound, which penetrates to the stomach, for example. So you have a gastrostomy tube, for example, that you put into the stomach. It goes into the stomach. Now you've formulated an artificial passage, so that would basically also invalidate the fast. Any puncture which communicates with a qualified cavity in that sense. So the following are not considered qualified apertures. So, for example, the duct of the eye, so the lacrimal duct, and the pores of the skin are not considered as qualified cavities. So this is clear in wahi, in revelation. So we from the hadith and also from the prophetic tradition. So we would take that into consideration, and I'll explain a bit of that later on, inshallah. Qualified agents. So these are agents that rejuvenate the body, food or medication, or do not rejuvenate the body. So it's not just suratan, meaning not just in the fact that they are like food or drink, but rather they don't have to be like food or drink, but they will still invalidate the fast. And the reason why that is because it brings about a sense of shahwa, a sense of appetite towards food. And there are other reasons that are given, but generally speaking, the Muslim scholars have all agreed, most of them agreed on this idea that it's food or medication or any kind of object that enters the qualified cavity would invalidate the fast. Agents that are edible or non-edible in that case, agents that are liquid or solid, doesn't matter. Agents that are soluble or insoluble, okay, so it doesn't matter if they're soluble or insoluble. And following do not invalidate air, which because it's natural, sensations of extremes of temperature, hot or cold, and I'll go into that in a bit more detail later on, inshallah. Qualified processes. So according to the Hanafi school, for example, that nullify is entering the it has to enter the qualified cavity and should disappear from view. That is a condition from the Hanafi perspective, which isn't the condition according to some of the other schools. So on the basis of that, in other words, that it has an individual stay. So in other words, for example, if you were to, and there's a hypothetical situation that's mentioned in the books of fiqh, that if you were to put a piece of meat on a string and the meat was passed down the throat, okay, and it went into the stomach, and then you withdrew it all, and the whole meat was intact as a morsel of meat, then that would not invalidate your fast. So that's the example that's given in the books of fiqh. But reality is that's a hypothetical situation. We know that if you put meat in there and swallow it, then there'll be remnants of that meat that will clearly come away and they would go into the stomach. So that would break your fast practically. But in the sense that is described there, the point to be made is, for example, if you were to put a gastroscope into the stomach and it was, returned and did not have independent stay there, then it would not invalidate your fast. If it had independent stay, then it would invalidate, because you can actually pull it out again. However, we know with gastroscopes, we put gel on them, and hence the gel is a form of remnant that would remain in the stomach, and hence that would invalidate the fast. Okay, now states which absolve qualified nature. So, for example, forgetfulness, you will be that would be even if you were to eat out of forgetfulness, that would not invalidate your fast. So even though they fulfill the previous 4 criteria, the fifth criteria is not fulfilled, so hence it still will not invalidate your fast. So arduousness, so fumes, vapor, dust, saliva, all these kind of things are clearly a sense of hardship. You can't possibly avoid them. So on the basis that that would not invalidate your fast. So the following would not be excused. So necessity, so you were ill, you had to take a certain medication, you took that medication, your fast will invalidate. Okay, you're excused, but you still invalidate. Ignorance, I didn't know, I didn't have the knowledge for that, that will still invalidate your fast. Accident, you fell or something happened and it landed in your mouth or something along those lines, okay, and you swallowed it, that would invalidate your fast. Coercion, if somebody was compelled to eat and they were forced to, that would invalidate your fast even then. Or sleep, so you did it unconsciously, you sleepwalked and you ate the whole meal, and then that would still invalidate your fast. So the point is that there are certain things that are considered as what we call muwani', and they are like forgetfulness and arduousness and so forth. So the criteria that must be met for the fast to be invalidated is there is a discernible visible substance, okay, which makes it the wasil. Okay, the substance reaches the digestive system, throat, stomach, or intestine. Okay, that's the qualified jawf al-mu'tabar, the qualified cavity. The substance enters from an early point connected to the entry point, sorry, connected to the digestive system, mouth, nose, anus, or deep abdominal injury. Okay, so it has to have a manfaz mu'tabar, the passage has to be qualified. The substance gains an independent state according to Hanafi school. No excuse is present, like for example, forgetfulness, etc. So these 5 criteria will then be met, and then the fast will be invalidated on the basis of this. So hopefully that sort of gives you the general overview. There are a couple of other things that are useful for those people sometimes. I'm going to go into a bit more detail in the little time that I have. Okay, we've got a bit of time, inshallah, and we'll sort of talk a bit about something related to that. And we got a couple of questions like, is the brain a qualified cavity? And this is a very important question, especially I get this question from ulama, especially because the books sort of indicate that. And then somebody's asking about PCR throat swabs. So these are related to what I consider as invalidators related to the throat or invalidators related to cavities. So what I'm going to do is I'm going to explain that in a short while to you all, hopefully, inshallah. And just before I do that, I think somebody wants to ask a question. Not Muhammad Farid, you want to ask a question? Come online, or maybe you just raised your hand. Okay, no problem. So what invalidates fasting related to the throat? Now, this is my own personal research that I've looked through an immense number of books of fiqh to come to this conclusion. But what I concluded from this all, and you may find people may not completely agree with me on this issue, but I think majority of people would. The substance must pass the shari throat. Shari is what we call the Sharia understanding of the throat. Okay, so I'll explain that in a short while. So it must pass that for it to invalidate the fast. The second is the substance must have a discernible body and not be a natural element of air. Okay, so this is an important point as well. So it has to have a visible body. Okay, so in other words, it may be a white sort of fume or something like that. So it's visible. There's a discernible body from there, of smoke. Okay, or something like that. So there are certain terminologies that we use like dukhan and so forth that I used even in the books of fiqh. So that has to be recognized. There is an intention for the substance to pass the shari throat. Now this is another very important point that needs to be stated here, and that is that even if you have an intention that I know that this is going to pass my throat, okay, and it does pass your throat, then that will invalidate your fast. Okay, if you know that this is what is going to happen, it's going to pass my throat to achieve, for example, if it needs to reach your lungs, then you know that it has to pass your throat to reach your lungs. Yeah, so there is clearly an intention there of it passing your throat to reach your lungs. So hence you've got the intention and it has reached your lungs, so therefore that would be considered as to many as something that would invalidate the fast. The substance must pass through an open passage and not just an absorption. So that basically means that there has to be a clear recognized passage and not just the fact that it's being absorbed through the bodily fluids and reaching that cavity. And I talked about this idea about there being a qualified cavity, and the Muslim jurists have been very clear about what is considered as a qualified passage and a qualified cavity. The substance must have independent state or disappear from view, and this is another point that we raised earlier on. And there is no state of forgetfulness and arduousness in the process. So these are some of the points that have been mentioned before, which relate specifically to the throat. So if you look at the throat, Muslim scholars do recognize the throat on the basis of where the letters come from. So you've got the kha and the ghain, that come from the top end of the throat. You've got the middle of the throat, which is ha and the ain, and then in the bottom of the throat, which is the ha and the the hamza. So the shari throat is in essence the middle to the bottom end. Okay, so it extends from those particular parts. Okay, so that is considered. So the shari throat ends at the point where you have what we call aqsal halaq. Okay, so bottom of the throat. That's where the sharia point of the throat ends. So the Muslim scholars have been very clear about this in terms of what they've stated in the books of fiqh. Okay, so this is considered as the sharia throat. Okay, in that sense. So it would have to pass this point. So just going back to that point, once it's past that point, then it's clearly now going to have a very direct flow into the stomach. Now once it's past a certain point, it will flow through gravity and it'll fall into the stomach. So hence, on the basis of that, this part of the throat would qualify it as something that's past that throat, would qualify it as being something that's invalidated the fast. Okay, so the sharia throat is this component here. So if it reaches the sharia throat, okay, in other words, then it would actually invalidate the fast. So you can see already that you're looking right at the back of the throat. That's the sort of area we're really looking at, or the blue type area. Okay, even below the blue area, really. So from the epiglottis area. Okay, all right. So the other point to make, I'm sort of looking solely from an anatomical perspective. The other thing that we have to understand is that the nasal sort of area, you have. So if you were to use a nasal spray, for example, so you were to insert a nasal spray in here, you'll notice that the nasal spray will reach as far back as, and it also swabs. So when you're swabbing, you put a swab in there, it will reach some of this area or the mucous lining here. And if you were to go as far as you can go, normally you're hitting sort of the end here. Okay, you're not going as far back as that. Okay, so if you were to put it into your mouth through your throat, so go back to that slide. So if you were to insert it, you'd achieve the back end of your throat here, but again the nasal septum would be, you wouldn't be able to put anything past that area if you were just swabbing. So on the basis of this, if you look at it from a different sort of angle, you'll see that even with eyes, so the lacrimal duct, again, it falls within the sinus around here, and you'll see that you've got the lacrimal points, and then here you have the inferior turbinate, which is the area there, and then hence that would land around about here. So you've got this particular area that would be affected if the medicine from the eye drops would fall into the nasal cavity. So it would land no further than this particular point here. Now, just to emphasize a point, because sometimes people do say this, and they say that, look, I used eye drops and it landed at the back of my throat and I could taste it. That doesn't mean that it's invalidated your fast, because even in the books of hadith, you'll see that the Prophet ﷺ stipulated that if by applying something to your eyes, it will not invalidate your fast. And that could be for two reasons. One, possibly because of, and I wouldn't go by that second reason, the first reason, and that is because of the narrowness of the lacrimal duct. It's so narrow that it wouldn't be considered. But rather, you could say that might be the reason why. The other is mainly because it doesn't pass that sharia throat. Yeah, the shari throat, it doesn't pass it. So it would land. So just because you're tasting something, then you know where the taste centers are. So if you're feeling a sense of bitterness at the back of the throat, which is usually the case, then you're feeling it here. You'd have to pass a lot further than that for it to enter the shari throat. So hence, just by tasting it at the back of the throat does not invalidate your fast. Okay, so just to clarify those particular points. Similar thing with the ear, recognizing there is a passage to the pharynx, but that would require one to have a quite large rupture of the tympanum or the eardrum, okay, for that to happen. So clearly, you know, if there is a large rupture of the eardrum and things are clearly passing through and they enter the throat, then that would be another reason for it to invalidate the fast, because now you've formulated a passage that goes directly into the throat. And even then, if it does land on the throat and it doesn't surpass the throat itself, the shari throat, then it will not invalidate your fast. It would have to pass the shari throat for it to invalidate your fast. So hence you can, even if you've got a ruptured eardrum, you know, even then it would not necessarily suggest that you've invalidated your fast. But out of caution, you'll find that Muslim scholars say that if you've ruptured your eardrum, then that would. So hence you would have to do qada, for example. Now, on the basis of that, you know, these points then arise. So eye drops or eye procedures will not invalidate the fast. So eye antimony, kohol or eyeliner, this is, you know, mentioned in the hadith of the Prophet sallallahu alaihi wasallam, it doesn't invalidate the fast. Eye drops or ointment, eye procedures would not invalidate your fast. Nasal drop sprays and nasal procedures will not invalidate the fast unless it clearly reaches or passes the throat. So clearly, if you sprayed something far enough and clearly you see it going down your throat, or you feel it going down your throat, then it would invalidate your fast. Otherwise, it would not invalidate your fast. So nasal swabs, aspirates would not. Nasal drops, sprays would not. But it's disliked if you're doing this in a way where clearly it's spraying right at the back of your throat and there's that risk. So anything that is a high risk because of ihtiyat, it's disliked that you do it. It won't invalidate, but it's a disliked act. Nasal prongs, which allow gases with no discernible body, will not invalidate the fast either. Okay, so ear drops and ear procedures, including ear syringing and things like that, they will not invalidate fast unless there is a large rupture of the eardrum and clearly reaches passes the throat. So any kind of procedure related to that. Sublingual medication, so these are oral procedures such as substances that just remain in the mouth, will not invalidate the fast unless it clearly reach or past the throat. So the fact that they've dissolved in the submucosal lining will not invalidate the fast. Now, if you're using nutritional things and putting them in your mouth, then that's another question, and I'll explain that in a short while. But sublingual medication or spray, dental procedures, dental paste, oral biopsies, injections, they will not. But there's a risk with dental procedures that you may swallow liquid, and hence it's disliked to use dental paste, chewing gum and things like that, especially chewing gum which is flavored and things like that. These are, you know, disliked. They will not invalidate your fast, but they are disliked. And especially if you are chewing gum or sweets in your mouth and you're just keeping them in the sort of the front part of your mouth, you also have to recognize that the flavoring of that is going into your saliva and you're swallowing it, and you're swallowing that down your throat. That will invalidate your fast. So there is a serious problem with that as well. Okay, so I think somebody wanted to ask a question. Raise their hand. So Salisu Ismail.
Yes, sir.
Okay, inshallah. Did you have a question?
Yeah, assalamu alaikum.
Wa alaikum salam wa rahmatullah.
Even though I sent some of the questions on the chat, I think I don't know that we talk about the intravenous fluid administration as well as blood transfusion to a fasting individual.
Very contentious question, and I will have an answer to that because that's the next bit I'm going to, inshallah.
Oh, good.
So I'll go through that into quite a bit of detail, inshallah. Okay. I will come back to your questions in shortly, but I think I'm going to be answering a lot of your questions now. So I'll just bear with me to the end of the presentation, and then inshallah we'll come back to that. So another thing is exudates, so discharge and bodily expectorates, things that come from the body cavity in the oral cavity which are swallowed. So it is only of small quantity or cannot be avoided from swallowing. So this is arduousness, hardship. For that reason, it's, you know, this would not break your fast. So pus or blood from oral cavity, nasal or pharyngeal cavity, as long as it's not dominant in the saliva. So if you bleed in your mouth and you're swallowing your saliva, then if your saliva is such that majority of your saliva is actually blood, then that potentially would invalidate it, especially if you're swallowing it, that is. So but that would not apply to things like phlegm and mucus and things like that, because that's arduous. Yeah. Now, if you were to vomit, for example, so if you vomit and you produce full mouth vomit, and clearly some of that you're going to end up swallowing. So you bring it up into your mouth and then you swallow it, and that will break your fast. And if you intentionally vomit, full mouth, that will invalidate your fast. Because of that reason as well, because it's an intended sort of act. Then you have aerosol procedures, and this is quite useful to know. So if the procedure requires that the fumes, gas, vapor reaches or passes the throat, then it will invalidate. If the procedure is intended only to remain in the mouth, then fast will remain as long as it does not reach or pass the throat. So smoking, shisha, e-cigarettes will. Inhalers, nebulizers, CPAP containing medication, or with steam humidifier, because steam contains water, yeah. And those that will not invalidate, well, things like for example, vapor rub, because that's a vapor, okay, and that's not discernible. So it has so all inhalers, there's a discernible mist from these inhalers. If there's a discernible mist in them, or vapor, then that would invalidate. Okay, so general anesthetic will with mask or intubation, nitrous oxide, things that won't, because they're not discernible. Perfumes, incense, steam, they won't. But if you do them intentionally, it's a disliked act, because what you're doing is you're sort of inhaling something which clearly is not something that you should be doing anyway, because you're fasting. But rather, it's even then it's a discernible body. Then if it's quite clearly a discernible body and you're inhaling it intentionally, then that potentially could break your fast. It can invalidate your fast. So procedures requiring intervention by the throat. So if the procedure involves independent stay of the substance or disappears from view, then this will invalidate the fast. So for example, gastroscopies, tracheostomies, nasogastric, feed, all these will invalidate the fast, because clearly they have gel that will invalidate the fast. That remain, the remnants of that remain. So that would dry swabbing of the throat or biopsy via oral cavity will not invalidate the fast, because it's clearly can be withdrawn. It doesn't have independent stay there, and hence, in that situation, it wouldn't invalidate the fast. Okay, right. Now, related to cavities, I recognize I've already got a bit of time. So there's a couple of things that's worthwhile noting. So principle one is that the qualified cavity must be internally concealed. So what is a qualified cavity? Something which is internally concealed. It's spacious and has a capacity to be occupied. Number two, the additional qualified cavity must be connected to the throat, stomach, or intestine directly through a patent passage which freely flows. So that's the other principle. So it connects with another passage, in other words, through a patent passage which freely flows. Principle three, if the additional qualified cavity is not connected to the throat, stomach, or intestine, so let's say it doesn't fulfill condition principle two, then it should at least be a means of strength and restoration to the body. And this is the point that I wrote a whole sort of an essay on, an article on, stating that this is the issue of suratan wa ma'nan. So clearly it doesn't fulfill the suratan, but it fulfills the ma'nan. In other words, the whole purpose of one of the main reasons is that ensuring that you don't gain strength from what you eat and drink. So clearly it doesn't fulfill, it sort of makes it invalid on the basis of that. So hence restoration of the body from that would be problematic if it's gone through a particular passage. So the additional qualified cavity must have a patent entry passage which opens externally. And this is important. There has to have a passage which opens externally. So it has to fulfill that condition as well. So in other words, going back to those particular principles, the cavity should fulfill the description and also be of reasonable size enough to hold. So there's a bit of description here in terms of the additional qualified cavity. If it should at least be able to contain a certain amount of fluid. The additional qualified cavity must be connected to the throat or stomach, which I mentioned earlier on, or the additional qualified cavity is not connected to the throat, stomach, but it should at least be by means of strength. It should not give you strength or restoration. And the final thing is that it should open to an external passage on the surface of the skin. Now, this flowchart sort of really sums that up. So you need to ask yourself, what is a qualified cavity? So if you are asking the question about blood circulation, so when we give ourselves intravenous fluids, and we give ourselves blood transfusions, then we need to ask this question: does it follow the description of a cavity? Yeah, and so the description of a cavity, which we explained before, is a qualified cavity must be internally concealed. The cardiovascular system is internally concealed. The brain, the cranium is internally concealed. Okay, the additional qualified cavity must be connected to the throat, okay, or stomach or intestine. So you find that the circulatory system, it doesn't directly connect with the intestine in this sense, but there are certain blood vessels that will take the ingredients or the nutrients from the gut to the bloodstream. So they're directly absorbed from the gut. Okay, so they're directly absorbed from the gut, and they go through the lining of the stomach lining, and they go into the bloodstream. Okay, the additional qualified cavity must have a patent entry passage which opens externally. So in that sense, so if you connect, if you make a formulated passage through the bloodstream directly with the external surface, so in other words, you were to put an IV fluid line in, then you're connecting clearly with the surface to the bloodstream, and you're giving yourself nutrients, then that would potentially fulfill this particular criteria and invalidate your fast in this sense. Okay, so here it follows the description of a cavity. If it doesn't fulfill the description of a cavity, then it does not qualify. Okay, if it does fulfill the description of a cavity, then the question is, it is connected to the throat, stomach, or intestine through a patent passage. Yes, it is. Okay, if it is, then it has a patent passage which opens externally, i.e. the mouth or the nose or the ear, or any kind of access that you've got, a direct tube into the stomach, you know, that you've done. So yes, it does, then it qualifies as an additional qualified passage. Let's say, for example, it doesn't. So it is a means of strength of restoration to the body itself. It's not connected to the throat, stomach, or intestine, but it does it itself. So it doesn't go through the intestine to do that. It actually goes directly into your bloodstream to do that. Okay, so yes, it does. So it has a patent passage which opens externally. Yes, it does, because you've used an IV fluid line. Okay, so then it will qualify as an additional qualified passage. So if you look at the brain cavity or the intracranial cavity, then intracranial cavity, even though you may argue and say that it fulfills a cavity in the sense that it is connected to the throat, but the thing is, it's not connected. So even the intracranium may be a cavity and a qualified cavity. It's not connected to the throat, stomach, or intestine. There is no, and in the classical text, Muslim scholars believed that that your nasal cavity was had a passage to the brain. Okay, so hence they would use certain fumes that they would inhale to affect the mind for that particular reason. So on the basis of this, you would see that the classical text suggests that anything that is, you know, taken up the nostril, or even, you know, in that sense, and you know, that would reach the brain, then that would be considered as something that invalidates the fast, which clearly is not the case. So it would not invalidate the fast. Okay, and this is quite explicit in the fiqh text regarding that. So anything intracranially would not invalidate the fast on the basis of that. So it has a patent passage which opens externally, so the brain clearly doesn't, unless you put a passage in there. But even then, it doesn't connect to the throat, mouth, etc. So that wouldn't, and nor does it qualify in that sense. So it qualifies, it doesn't qualify in that sense. So that sort of relates to the intracranial cavity. Okay, so this is a very quick diagram which gives you some kind of overview of the questions related to this. So the kind of things you need to ask is, these are things that will invalidate, these are the things that will not invalidate, and this will not invalidate as well. So anyway, so you got an entry point. Okay, substance does not need to have nutritional medicinal benefit. So clearly, even if it doesn't have nutritional benefit, it enters an external surface, goes through a patent passage, enters a qualified cavity, for example, the throat, and then through a patent passage enters another qualified cavity, such as the intestine or the stomach. Then it's gone through the blood circulation and it gets sent to the whole body. That clearly will invalidate your fast. Okay, so it has to be, you know, this is, it does not need to have nutritional medicinal benefit either. So even medicine that's given this way would invalidate the fast. Okay, so a substance that does not need to have nutritional medicinal benefit, if in the digestive tract as well, would also fulfill that condition. Okay, that it will go into the qualified cavity, because what it will be doing, or substance needs to have nutritional medicinal benefit other than the digestive tract. So for example, if you swallowed a pebble, for example, so go through a patent passage, go to the qualified cavity, it won't go into your blood circulation, it won't give you strength, but it still invalidate your fast. Okay, now on the basis of that, you also have a situation where a substance needs to have a nutritional medicinal benefit. So if it has nutritional medicinal benefit, and it goes through a patent passage such as an intravenous line, and it goes directly into your blood circulation, then it still applies the strength to the whole body, so that would invalidate your fast. Things that won't invalidate your fast is something that you pass, for example, subcutaneously, so it goes into your tissue of your body, so there's no patent passage there, and it goes straight into your blood circulation, then it would not invalidate your fast. So if you were to absorb something from your submucosal lining in your mouth, that will not invalidate your fast, even if it goes into the blood circulation, because you don't have a patent passage. Okay, so the main thing is the patent passage. You've got a patent passage, and whether it goes into a qualified cavity or goes directly into blood circulation, it will invalidate your fast. If there is no patent passage, then it will not invalidate your fast. Okay, in that sense. Okay, and then this is a list of all the things that do or don't. There's an immense number of questions here. So where am I supposed to start? So hopefully I've answered a lot of your questions, inshallah. Okay, so is it pain meds not medicinal benefit, or is it antibiotics? Sorry, is it pain medication not medicinal? Oh, sorry, pain medication has medicinal benefit. So yes, okay, so that would count as invalidator of a fast. So okay, the point is pain relief. Okay, I understand now. So pain relief via IV fluid, via IV injection, let's say, for example. So injecting something into the veins, which is an analgesia. Okay, so in that sense, pain, yeah, medicinal benefit from the Shari perspective is described more so as tadawi. Tadawi is something that rejuvenates the body. Okay, so in other words, it rejuvenates the body. That's what tadawi usually indicates. So even though we would classify pain relief as tadawi, it doesn't fall within the remit of rejuvenating the body, because it has to be something which gives quwwa, strength, suratan wa ma'nan, yeah, in terms of in its property, okay, through a root that is recognized in the Sharia, and these are the roots we just described, or ma'nan, meaning even in its solely from its property basis, it enters the body in a certain way, it gives you strength. Having done that, then that would also invalidate the fast. Okay, so the whole point there is, so yeah, so that's a good question. But pain relief given IV would not invalidate the fast, but if you injected it with the liquid that goes with the pain relief, then that will, because what you're doing is you're giving yourself liquid, which potentially is, can invalidate the fast. Okay, so the pain relief itself usually would come in a liquid form, so I suppose it will, on the basis of what it contains, rather than the pain relief itself. Okay, let's try to answer many questions here. Brain cavity, qualified cavity. Well, I explained there that brain cavity is not considered as a qualified cavity because it's not connected to the throat and the nasal cavity and the digestive tract. So for that reason, it doesn't qualify, even though the classical kitabs have mentioned that it does. We use their principles rather than the furu, and on the basis that it wouldn't. PCR throat swab goes to the back of the throat, and hence it's dry, and hence it won't invalidate the fast. It doesn't pass the throat. Okay, that's a good question. Istinja, water basically inserted through the rectal area. You must ensure it doesn't pass the rectal pectineal line, is the point that we normally describe. The reason why is because the blood supply that takes from the pectineal line above goes to the digestive tract, and the other sort of doesn't. So well, it goes to the portal system through that sort of direction. So I explain this to a lot in my article. So yeah, istinja, you should ensure that you don't push the water too far up in that sense. Otherwise, it potentially can invalidate your fast. Peristalsis rather than gravity. Yes, very good point. Peristalsis is the right word to use, because that's usually due to the muscular contractions of the lining of the bowel, yeah, and that would pass it through, yeah, because you could be lying down, and clearly that's, yeah, a good point. So peristalsis is what passes it through. So if it enters a cavity and then on the basis that it will automatically fall into the next cavity through peristalsis, then that would invalidate the fast. Okay, so we're just going further on. Does an injection for pain relief such as corticosteroid or a vitamin injection invalidate the fast? Again, same point. Corticosteroid itself, fi nafsihi, in itself, would not invalidate the fast, but it usually is contained within a liquid, and that liquid is, it contains water, and hence that is rejuvenating, and that would invalidate the fast. So any of these kind of injections are problematic if they go directly into the venous system. If you're subcutaneously injecting them or injecting them into joints, they will not invalidate the fast, okay? Because they don't go through a qualified means. Nasal drops not eventually go down the throat. Nasal drops will not invalidate the fast unless clearly they pass the throat. Yeah, so you should not be if you're putting an immense amount of nasal drops in there that it passes the throat, then that will invalidate the fast. Using tampons invalidate the fast? Yeah, very good point. So notice here that any kind of procedure to do with the vaginal area or the urethra will not invalidate the fast. The reason why that was, that some scholars have said this and still do say this, is because the books of fiqh at that time, there was an understanding, there was an anatomical understanding that the womb was connected to the vagina, the womb were connected to the intestine. Also, there was an understanding that the urethra was connected also. So there was this particular understanding, and hence there was a qualified passage hence to those cavities, and hence they would say that it would invalidate. So tampons and things like that do not invalidate your fast, no. Subcutaneous fluids over 16 hours, based on your presentation, it is not a patent passage. Subcutaneous fluids, yes, does not invalidate the fast. Subcutaneous fluids will not invalidate your fast, no, but that can be a source of nutrition. It can be a source of nutrition, but it doesn't go through a qualified passage. If a person is taking subcutaneous fluids with this intention, that I am going to get rejuvenated and hence, it'll make my fast easier, then yes, you will still have your fast. It will be considered as makruh, yeah, and they will be sinful because their intention is faulty. There's a problem with this. So clearly, there are obstacles there. Doing a PR examination, a vaginal examination will not invalidate your fast. PR examination, if you're using a gel, which is usually the case, then yes, it will, because you have to go far up the rectal area, and you are leaving a gel there. So there are remnants that will remain, and that will invalidate the fast. So inshallah, I think I've answered most of your questions. Okay, inshallah. So hopefully, alhamdulillah, a bit rushed. So hopefully that's been beneficial. I will answer one question online. I'll ask somebody who has not asked a question yet. So I think Muhammad Farid, I don't know whether you want to ask a question. Your hand's just been raised. If not, then Siddiq.
Assalamu alaikum.
Okay, so Muhammad Farid, yeah, go ahead.
I was wondering the use of dermal patches, nicotine, like fentanyl patches, for pain, for chronic pain patients. Will that break the fast? And
it
also,
will not invalidate.
In the good old days, people used to have tobacco sniffing, snuff, they used to call it. Is that because that's a medicine in itself, and it used to make them euphoric, or basically it serves the purpose of cigarettes? So will that break the fast?
So if they're putting this in their mouth, is that right? Yeah. So they're putting it in their mouth, and they are,
sniffing it. They're putting in the nostril. They're putting in the
Sorry?
nostrils. They're putting in the nostrils.
All right, putting in their nostrils. Okay. So if they pray in their nostrils, then it would not invalidate their fast. Yes, they may get a sense of euphoria, but that it defeats the whole idea of fasting. So it'll be considered as, your intention is wrong. So the intentions,
Right.
have to be right as well. So, if your intention is wrong, then, but the point here is about whether it invalidates the fast, whether you have to do qada. And that there, they would not have to do a qada. No. Okay. We got Yusuf. Yusuf, Amir? Are you there? No? Okay. I think people are raising their hands, but they're not coming online. If you're not speaking, if you could just mute, please. Okay, so Alia. Okay, I think people are just probably doing it by accident. Okay, no worries, inshallah. Hopefully that's been really useful. These slides will be available, inshallah. We'll make sure that those people who have registered for this, inshallah, then we will formulate a platform where you can actually have these slides available to you, inshallah. And there is a whole document, in fact, there's a whole document on this for immense detail that's in there for Sharia scholars. I know there's some ulama here as well. So for ulama as well, and as well as the general sort of people from all different fields who are interested in this area. And a lot of this detail is covered in those articles, inshallah. And there's also a search facility on Al-Balagh Academy that will allow you to sort of journey through some of these questions and give you some of these answers, as been mentioned on this particular template here. Also, a point just to raise is that this is clearly something that you're all benefiting from, inshallah. And at the moment, Al-Balagh Academy is expanding quite immensely, alhamdulillah, with the tawfiq of Allah subhanahu wa ta'ala. So please, if you do see any donation links of Al-Balagh Academy, please do support us. There's a lot more resource that we are trying to pull out tomorrow on some of these issues, especially medical issues. So end of life care, we're going to be looking at pulling out a lot of protocols and policies which will inform people to the degree that and the detail that we're doing here, inshallah. So please support this effort, inshallah, because this is it's important that we know and we have Sharia scholars who are clearly intersecting science and the Sharia together and coming out with some really solid conclusions. So for example, even in the books of fiqh, it mentioned intracranial cavities and things like that, and they break the fast. But now, using our medical knowledge, using our understanding of the Sharia and the principles of the Sharia from those very same fuqaha, we can conclude that what they would have concluded today would be quite different to what is stated in those books of fiqh. So inshallah, we make dua to Allah subhanahu wa ta'ala. Allah give us a good understanding of these masail in fiqh, and also give us this spiritual uplift so that we are able to achieve the whole purpose of fasting Ramadan, which is taqwa. And inshallah, make dua for us, we'll make dua for you. Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.